Yeah. There we go. All right. Thank you all so much for joining us today, either if you're here live with us in person or if you are reviewing this in the video series. I'm excited to talk about the topic of AI compliance within healthcare. It's really such an important topic because we all know that AI is here to stay and everyone is using it. But what we might not know is how is it applied within the healthcare industry, and how do we make sure that the information and the decisions that are made are being safely handled. So that's why I teamed up with Elizabeth Skinner, who is an expert in these things, to speak to us about some of the challenges that we're seeing in healthcare and some of the ways that we're looking to mitigate those risks. I ask that if you have any questions, please be sure to add them to the end of the presentation so that she has enough time to cover the content.
Well, good morning, everyone, and thank you, Shakira, and thank you, Dr. Sabri. I'm very
Sure.
excited to be here. And oh, do you need to go through this slide first here?
Yeah, let me
Okay.
just give a quick introduction really quickly. So if you're new here, my name is Dr. S.K. Moreland. I'm known as the HIM Concierge, and I'm the founder of HIM Concierge Services. And I consider myself to be the conduit between students and professionals, education and the industry. And I'm really hoping to create a continuing pipeline of knowledgeable professionals that are ready to step into the workforce. But back to the point, every quarter, I like to talk about a different section of HIM. So whether that's revenue cycle and coding, data informatics, data analytics, informatics, or in today's case, information governance and compliance. And I like to team up with professionals that have incredible knowledge and experience in the industry so that professionals can get a firsthand look at what it looks like if they decide to go into the field. Because that's really what's going to help you understand if that's really something that you want to pursue or not. And so that's why, again, for today's presentation, I teamed up with Elizabeth, who has a ton of industry experience, and she was really eager to share the information within this presentation. So I'm excited that she is here today. And
Thank
I'm
you
going to
for,
do a quick
oh,
introduction, if that's okay.
that's okay.
She's eager. So at this time, I'm going to introduce our speaker. She has over 15 years of executive leadership experience in healthcare compliance. Elizabeth has been responsible for administering compliance programs, directing, auditing, and monitoring initiatives, and providing regulatory compliance education to colleagues and leaders while directing complex compliance and privacy investigation. Elizabeth has led a team of compliance professionals and serves as a regulatory and policy resource for leaders and colleagues throughout. Elizabeth and her husband enjoy spending time with their daughter, daughter-in-law, two beautiful grandchildren, gardening and volunteering in their community and church. So, welcome, Elizabeth.
Thank you so much, Dr. Marlin. I really appreciate the introduction, and we can for sure go to the next slide.
Okay. Okay, perfect.
So the objectives here are because we're talking about compliance, the objectives are about understanding the challenges and risks in using AI and the ability to name major components of an AI framework. Because if you have oversight of AI in healthcare, then you can understand the compliance risks and the compliance concerns. And then finally, can you speak to the balancing act? And this is where we talk about safeguarding the protected health information, the medical records, uh, so many other issues that are relevant to healthcare in that medical record. And so we want to make sure there's guardrails to control those risks and still encourage the innovative use of emerging technology. And when Shakira gave the introduction, she said this quarter was focusing on compliance. And a lot of people start snoozing and going to sleep when they hear the word compliance. But I think it's really interesting because it protects the patients and the employees and the healthcare systems. And that's why I loved being in compliance. So when I first started to hear about AI, I thought, okay, well, we can't be all about the risks and all about the concerns. We have to remain open-minded and think about how is this going to improve healthcare, and then what do we do to make sure that we have the guardrails. So we can go to the next slide. So challenges, look at that robot. This is one of the reasons people seem to have a fear about AI. So no, they're not going to replace us. Humans are still more important and more knowledgeable than AI. Work outside that framework, whereas AI is limited to that framework. It's fast-paced, emerging technology. we have to develop policies and procedures that relate to AI, and that's a big job. And we're just starting to do that in the healthcare systems now. And it's one of the things that I was very interested in my previous role as a chief compliance officer at an organization in Iowa. So developing review processes and understanding what the vendors have for artificial intelligence, because who's going to make the decisions about purchasing those tools, and how much control does a vendor have over us once we do decide to work with a vendor? Very, very important thing to consider. And then who's accountable for monitoring AI use? And then how do we make sure that we have standardized training for all people who are going to be connected to artificial intelligence? And when Shakira was talking about the role of the HIM professionals, whether you're focusing on revenue cycle or coding or any type of electronic health record expertise or any kind of specific management processes within HIM, you have to be able to get the training you need to understand AI. So make sure that wherever you intend to work or wherever you are working, that you get to know those those AI professionals, technology professionals who understand AI. So addressing those challenges, get to know the people who have this knowledge. Shakira introduced me as an expert, and I'm not an expert in AI for sure, but I had to understand it as a compliance officer. I had to understand, how does it work? Where are we using it? What are we going to do with this information that we have about AI? How are we going to teach people? And how do we make sure that everyone who's connected to the medical record understands how it's going to impact healthcare? So get to know the chief technology officer, the IT officer, your chief compliance officer, your privacy people. These are the individuals who have very knowledgeable experience, but they also are getting information about the latest tools. So we want to make sure that we develop. We have a little box on the side of the slide, and it's covering up my words here. I hope that's not for the attendees too, Shakira. I don't know if you can see that rectangular box. It's a dark box on my system, but there we go. Perfect. We want to make sure we develop overriding AI policies to address other relevant policies. So we don't want to create a whole new library of artificial intelligence policies. We want to make sure that the policies we have that are connected in any way to artificial intelligence tools or processes address those to make sure that we're thinking about the risks. So how do you do that? Well, get involved in an AI work group. As an HIM professional, if you see your role as an entry level role, it's okay to speak up and say, I want to be on a work group with other people so I learn. When leaders see that you're interested and that you're curious and that you want to be involved, that's going to do nothing but help your career. So it also helps make your work easier. And I think it makes it more fun. Once you're involved, you're going to have a lot more fun in your work. So AI work groups are being established in the large healthcare systems, and hopefully the smaller healthcare systems are finding a way to get those tools and processes as well. If you work for a very small organization, you might have to partner with a larger one to understand how is that larger organization addressing AI. So get involved in your associations, whether it's through a HEMA or through sometimes there's a state healthcare association that addresses AI work groups, and get involved and understand, because the leaders in your organization need to understand what these tools are going to actually do in their system before they purchase them. And it would be great if an HIM professional could be work group, because you understand how the electronic health record works, you understand how your processes are currently set up. And so getting involved in those work groups is survey vendors before tools are used, and that's a leader's, obviously the purchasing leader's responsibility, but it's something that if you understand that's going to be done in your organization, it gives you kind of comfort level of, we know what kind of vendors we're using. about. And then in your organization, somebody's got to be accountable for reviewing, monitoring, and training AI. And it can't be the compliance officer's job alone because, again, they're not the technology expert. But to have your compliance people involved with your IT people and the HIM professionals makes a perfect partnership. So some of the policies, I'm not going to read all these policies to you. I just handpicked a few from the organization that I most recently served. And this was just a few months ago. We were talking about all the policies that we would need to address if we were going to make sure that we were thinking about AI in all aspects of healthcare. And so obviously the ones that might jump out to you are data use. Who has authorization to use data? And do your HIM professionals understand who they can give information to and who they need to call if they're concerned about some type of coding pattern that they're seeing because it's connected to a new AI tool you're using? Um, has the compliance team talked to you about a risk assessment with respect to HIM? Have they put into their compliance work plan what they're monitoring and helping the HIM team with going forward as new tools are purchased? And billing and coding, obviously, there's many different types of expertise within HIM, but many HIM professionals are focusing on medical coding. And I think it's really important that we think about the fact that yes, AI will be used to help make coding more efficient, and it will probably be more rapid. And so we want to make sure that there aren't errors when that happens, but also it frees up the coders to focus on other skills. And we'll talk about that a little bit more in the presentation. Next slide. So here are those risks I was talking about. And we, again, don't want to be the naysayers. We want to just be knowledgeable and be transparent and honest about the risk, patient safety and quality. Many times, people in the chief medical officer's team or the clinical patient safety teams or the risk manager teams rely on HIM professionals to get them information when they're performing an investigation, or they're going to address a safety concern, or they're going to start a new clinical service line, and they want to know and they need information from the HIM team. This patient safety and quality information is vital to protecting our patients and making sure that we have smoothly operating healthcare systems as well. And so we need to make sure that the artificial intelligence tools that we're using are gathering a the right information, that it's available, that people can obtain it. And so your role in working with all these other teams is vital in protecting patients. So we want to make sure that our patients get the care they need, and it's safe care, and that artificial intelligence tools and processes aren't putting any risks in that. Privacy. I spent a great deal of time over the last 15 years working on privacy and security issues, and I've learned so much from privacy and security experts. And we want to make sure that the artificial intelligence tools we use aren't sharing information inappropriately with other individuals or other systems or other platforms that somehow spread our patient information where it's not safe to share it, that we don't have authorizations in place, or that we aren't protecting the privacy of our patients. Fraud and abuse. So the False Claims Act is the federal law that most compliance officers are very keen and knowledgeable about, because we want to make sure that we never have that problem with the government. The government is, and in commercial insurance companies as well, obviously patients are all concerned about any kind of healthcare fraud or healthcare abuse. And if you work for a healthcare organization that has solid mission, solid core values, good people at the top, good people that want to work there, You probably don't think about fraud and abuse much, but sometimes an honest mistake can lead to a government investigation where the government is alleging that there's fraud or abuse. And then, of course, all of us read in the papers that there are bad actors out there who do commit fraud and abuse. And we want to make sure that any AI tools we're using do not increase our risk for that in any way, shape, or form, not internally by our own people and not externally by any bad actors. So again, I say be very careful who your vendors are because the vendors, I don't want to criticize them. There's plenty of good vendors out there who love their work and love their product, and they're trying to make a difference in healthcare as well. But there are vendors out there whose sole purpose is to increase revenue, and they have an AI tool that might help them to get more revenue. And we need to make sure that that doesn't impact medical decision making by our teams and accurate coding by our people. So I'm trying to make it clear and not be criticizing others, but it's just a really big risk in healthcare, fraud and abuse. And then cybersecurity. So we all know that everyone is under threat from cyber attacks, and I guess it's probably been in the last 6 or 7 years that I've unfortunately, had experience with some very severe cyber attacks at two major healthcare systems, and this is happening everywhere, all over the country. And I'm sure you get plenty of notices from your own banks and your own insurance companies saying that there's been some type of cyber attack or threat. And our IT security people at the large healthcare systems they have incredible tools and processes. And I hope that the smaller organizations are able to get that same type of quality in their IT security tools and IT security people. They have to stay ahead of the bad actors. That's something that is very challenging for IT security people. They have artificial intelligence tools they're using, and if the threat actors have more sophisticated AI tools, then they can still cause these terrible disruptions, threats to patient safety. Because I've been involved in investigations where the threat actor has actually corrupted our medical records, and that is so frightening for patients to not be able to get their records, or for doctors to not be able to get their records. So fortunately, we're learning, not we're learning, but the IT security people are learning how to stay ahead of the curve and make sure that we protect those records. So HIM professionals, anything that you can learn about IT security, cybersecurity, and what type of AI tools and systems they're using to protect those records and systems, it's going to help you to understand your work better and do a better job with your work, and also help you in your career. Next. So AI can make mistakes. People make mistakes, and artificial intelligence tools can make mistakes too. So clinical leaders have to review and approve all artificial intelligence tools with the potential to impact any patient safety and quality. And one of the examples that I give is something that I learned when I actually had the honor and the privilege to hear a presentation from a physician who was demonstrating DAX, which is one of the artificial intelligence tools that is being used in a lot of electronic health records. Being connected to electronic health record systems, and healthcare systems are using DAX to allow a physician to perform an examination in the clinic, and they're spreading it to other service lines as well. But a good example that I was able to observe was a physician actually interviewing a patient, examining a patient in the clinic, and using a system called DAX. Make sure that DAX recorded absolutely everything that the physician said to the patient, everything the patient said back, and then was able to actually create a record right then and there on the spot. Many of you may already know about this, and you may know a lot more about it than I do, but I just thought it was a good example, because if the voice recognition recording misinterprets, if the AI I'll call it a robot, but if the AI tool somehow or the robot somehow misinterprets the patient or the provider conversation, it can impact what the AI tool puts into the record. So again, physicians and nurses and any other clinical bedside people need to make sure they review what their AI tool is creating in a record to make sure it's accurate. And I see Dr. Moreland shaking her head. It's really important that people are still a part of the process. And an HIM professional could spot something in a record while doing a routine task of some sort, or as a part of an auditing process that an HIM team has developed to make sure that AI tools are not making mistakes. I mean, I'm not sure how this will all develop over the next few years, but I can see that HIM professionals are going to start to becoming more audit-like in their roles, and they're going to maybe spot mistakes that are very important to protect our patients. So the more you learn, the more valuable you are, but also the more, I think, the more meaningful your career will be. Next slide. So privacy. Oh, I could talk for days about privacy and bore you all to death, but instead I'll just go over the highlights. So patient privacy is called PHI, patient health information privacy is PHI. Employee privacy, PII, personally identifiable information. We started talking about that a few years ago in the compliance world, and our employees are entitled to privacy as well. And so we have to be careful what we allow to be shared with anyone else outside of the system. And so again, an HIM professional could identify some some employee information that should be protected because it's personally identifiable. And we need to make sure again that those data use agreements that our systems sign, the compliance people need to keep on top of that and share that with the HIM team in terms of what we're allowed to release, what we're allowed to share. Very important, whether it's patients or employees. And then data privacy. Oftentimes, associations or government departments will ask for information, and we need to check with compliance or legal before we release any data outside the organization, even if they say they're a government agency, even if they say that they're with the state healthcare organization, or even if it's for a public health purpose. Make sure you go to a leader and say, is this something we're allowed to do? These kinds of questions used to come to me as a compliance officer, and sometimes I could answer the question because there was a regulation or rule for me to read, but other times, excuse me, I had to call the law department, excuse me, and see what kind of agreement we had in place. And we had to put our heads together, the compliance officer and the legal team, to say, I'm not sure about this one. We need to be careful, and talk to the people at the other organization and ask them, why are you using this data? What do you need it for? Because again, we need to protect our patients, our employees, and our systems and proprietary information that the healthcare system may own. And then de-identified information can sometimes be re-identified by artificial intelligence tools. This is not something I understand, but I've read about it, and I think it's really important that we understand. Again, this is something that might be built into the system, or it might be a mistake that the AI system somehow makes. But again, our leaders need to be reviewing these tools and make sure that we don't have any AI tools that re-identify because it's private. Next slide. Legal risks. So again, we were talking about fraud and abuse earlier, and so billing and coding errors could implicate the False Claims Act. And then this can also trigger potential kickbacks, especially with those vendors. So vendor AI tools and vendor agreements may incentivize a vendor, and we have to make sure that our vendors are honest and they have integrity, and that we have agreements in place about how we work with them, and that the technology professionals on both sides understand whose AI tools are connected to our system. Next slide. Cybersecurity, I talked a little bit about it earlier. The advantages that the AI tools provide through our own healthcare systems and the cybersecurity teams is enhanced threat detection, proactive defense, and rapid response. And these terms are terms that our IT security people use when we're answering questions from the Office for Civil Rights, when they have, if they have a, what they call a data response or a data request that they send to the healthcare organization because either a patient has complained or we have had to report some type of cybersecurity threat to the Office for Civil Rights. And so I think it's been within the last 3 or 4 years that the Office for Civil Rights, which is part of the United States Health and Department, excuse me, Health and Health Services Department, the Office for Civil Rights is part of DHHS, and they are like the police of privacy and security. They're like the police of the prohibition against any type of retaliation or any type of discrimination. And so the Office for Civil Rights, they require, in the last few years, they've required that IT security systems at healthcare organizations have threat detection tools, that they have proactive defenses and rapid response. And now with the increased AI tools, our political environment changes with administration to administration. I don't know what lies ahead. We don't know what the future will bring with respect to the political control over the Office for Civil Rights right now. But I suspect that the OCR is going to continue to say, well, wait a minute now, what kind of AI tools do you use? And hello, do you have enhanced threat detection to make sure that the threat actors don't have more sophisticated AI tools than you? Because the OCR, the Office for Civil Rights, they expect healthcare organizations to be very vigilant and very sophisticated with respect to our patients' healthcare records. So you HIM students and all of you HIM professionals are part of a very important team. And anything you can learn about working with your cybersecurity team, again, protects our patients. So what are the risks? Adversarial attacks, manipulating algorithms. That's what these threat actors can do with their AI tools, is manipulate algorithms that are already in place by our own internal teams trying to keep those threat actors out. Privacy concerns with data stores. They say that if a threat actor gets into our system, or we have AI tools that aren't the best the best in the organization, or not in the organization, the best tools available in the industry. There can be biases and lack of transparency that lead to unfair targeting and discrimination of groups with respect to blaming people for privacy risks or security risks because the AI tool doesn't understand bias. So really important that our systems understand. We need to make sure that we are very, very fair and clear, and that we are treating all people the same, and all systems are set up to be detecting any bias or any unfair targeting, if that. So what's the AI framework? Another thing that I've been reading about lately is the paradigm shift in healthcare because of artificial intelligence. So what does paradigm mean? Well, paradigm can mean model, or it can mean pattern, or it can mean a framework. And so this whole idea of artificial intelligence is changing healthcare in a huge way. That's when you read that there's a paradigm shift in healthcare because of artificial intelligence, they're talking about the framework. So artificial intelligence, what's the definition? It's a machine's ability to perceive or synthesize or infer information to perform cognitive functions, what a human mind can do. It's trying to mimic or copy what humans can do. And so that definition comes from an organization, a security organization called SOCI, and it's back in 23. We'll probably see additional definitions of what AI is, but I thought this was a good one because as a professional, if you're a student, you're learning to become a professional. Maybe you already are a professional getting another career. As an HIM professional, people are going to ask you, what's up with this AI and why is it such a big deal and how does it impact healthcare? And so you need to be able to understand, no, it's not a bunch of robots coming into the hospital. It's a machine's ability to do and perform this work that copies what we as humans think. Next slide. So the components, we said part of our objectives for today, and I'm looking at the time, we're doing okay. Um, So part of our objective today is to understand the components of this framework. And so again, as a professional, you need to be able to articulate clearly to people something that's very complicated and new. I mean, when I first heard about AI, I didn't have some of the information I have now. I've had to teach myself a lot because we didn't have standardized training in place for AI, and we were all kind of scrambling as compliance professionals going, what does this mean? And of course we were worried about the regulations and the rules from the government and the federal laws and state laws that govern healthcare, and how would it impact that. But we had to understand, how are people using it, what is going on, what has our system done. And so I think a good way to look at artificial intelligence is understand that its framework is made up of learning, of reasoning and decision making, of problem solving. It can perceive information, and then it processes language. So that's how AI is able to interact with the world and perform complex tasks. And so it's data analysis, it's robotics. Again, the IT people, the AI experts can explain this in further detail, but I just thought it was important for those of us who are not the AI experts that we understand what is the framework, and this is what it is: learning, reasoning, problem solving, perceiving, and language processing. Balancing act, this is the part that I get real passionate about. So we want to establish guardrails, but we still want to encourage the use of emerging technology, because as healthcare professionals, whether you're on the clinical side, whether you're on the business side, whether you're in compliance or legal or HIM or revenue cycle, you need to be able to see the benefits to our patients, and that's the encouraging. We want to be part of the team that encourages the use of emerging technology, but we also want to be not the police, but the people who say, wait a minute, we have to have guardrails. We have to have guardrails to make sure that it's still safe, that we understand what's going on so it doesn't get out of control. And we're like, well, where are these coding patterns coming from? Who said that we should accept this denial rate? Maybe we need to take a look at this. We need to be the ones that ask. HIM professionals who are curious and want to know what and why and how is AI working are going to be the ones that help the leaders in other departments understand we got to have some guardrails. Next slide. So what are those guardrails? Well, again, I'm kind of repeating myself, but I think, trying to put this all into a 1 hour presentation and think about the compliance and legal risks is understand your organization's approach to AI. Who implements it? Again, offer to join or establish a work group overseeing the processes that review AI, and include your technology leader, your compliance officer, and your legal counsel. If you're invited to a work group and none of those people are in it, say, wait a minute, we need an AI expert, or we need the compliance officer, or we need one of the lawyers to be on this work group. And then verify who's accountable for overseeing those policies for your organization, because HIM departments typically have a lot of their own policies. And I would say you would be wise to have a work group to work on revising those with respect to any reference to AI, because the IT people are going to bring something that the rest of the group wouldn't understand. The lawyers will bring something, the compliance officer will bring something, the IT security person may be able to weigh in on some of your policies. Work groups are very helpful in healthcare, and I learned a long time ago a well-functioning work group that gets along well together can make incredible strides and be a lot more efficient, and help get people to buy in to understanding what your new processes have to be to protect our patients and their records. Ensure clinical leaders review those AI tools that impact patient safety before, and I just thought that's part of the guardrails here. Next slide. So we want to verify who's going to train the providers on the use of AI with EMR and review medical record documentation close to time. And again, we talked about DAX previously. So we want to make sure that the patient's still in the clinic while the physician's quickly reviewing that note so that they can make any changes or ask any questions. Verify there's a checklist for contract review. Obviously, that's probably the law department and the compliance department's job to make sure there's a checklist for contract review to determine if a vendor or party utilizes AI, but it's good for HIM professionals to know that, because if you have a vendor that you're worried about and you're thinking, I don't know if we're really give them all this information. And it seems like this AI tool is just automatically spitting it out to them. You need to call your lawyers or compliance people and ask them. And then you might ask, do you have a checklist when you work with these vendors? And they go, no, why would we do that? Oh, I heard about it at some presentation. And they go, oh, that's a good idea. Request updates from legal and compliance on AI-related state and federal laws and agency rules. Again, that work group, it would help a lot if you were in a work group where they were making sure that those types of issues were addressed, because AI is just going to keep changing. It's just going to keep getting more and more prolific wherever it's used, and it's going to get more and more sophisticated. So good to have a team to work with. Next slide. So I guess I talked pretty fast today because this is the last slide, and it was Brian Tracy's quote that that really stuck out to me when Shakira and I were talking about a presentation like this a few months ago, and the quote is, "Leaders think and talk about solutions. Followers think and talk about problems." So it's really important that everybody decides, I'm in healthcare. Why am I in healthcare? What do I expect to offer to improve healthcare? Because we definitely need improvements in our healthcare system. So do I want to be part of the problem, or do I want to be part of the solution? And I also read a recent quote. I don't have it memorized, so don't quote me on the exact words, but it was from Albert Einstein, a genius, right? And he was talking about intelligence. And he said that people who are able to adapt to change show intelligence. And if you fail to adapt to change, you can't really be very intelligent. And I just thought, wow, that's coming from a genius. That's very interesting. So I just add that because Shakira had said that she had a few questions, but quick before she does, I did want to say that I'm very impressed with some of the articles that the AHIMA Journal has put out on artificial intelligence. So if you haven't read any of those, I highly recommend that you Google them, or if you have a subscription to AHIMA Journal, that you take a look at some of those AI articles. There was one in October of 23. Now that's a year and a half ago already. And I thought it was really well written. And so I took some notes from that article, and the parts that I was really impressed with, and I'm looking at my notes here, are three areas that they say are really important for HIM professionals to focus on with respect to understanding artificial intelligence. One is the ability to adapt to change, which we just talked about. Two is attention to detail. And obviously, if you go into HIM, you're a person who is probably either willing to be someone who pays attention to detail, or you're very good at it already, or you're going to learn in your education or in your profession. But it's very important because careful management, this was a quote in that article, careful management of patient health records is necessary. And this required, this necessity, this attention to detail requires accuracy. And of course, that's attention to detail. We have to have accurate medical records. So anything that AI does to in any way create a risk with accuracy, it's important for HIM professionals to understand that. So very important characteristic, attention to detail. And the third category was applying critical thinking. You have to keep up with technology improvements. And remember, I said if you're someone who asks what or why or how, you're able to develop critical thinking skills. And if you haven't had any courses yet on critical thinking, you might want to just Google it and read some articles about it. But if you have the opportunity to take any courses with respect to critical thinking, it's a very important skill, and it's something that really separates the followers from the leaders. I feel very strongly about that. I have built teams over the years. I've hired people over the years. I was always looking for someone that had critical thinking skills, and most importantly, I always look for people with good soft skills. And I think that hopefully your HIM program, if you're a student, is focusing on soft skills, or if you're a professional, you're continually trying to improve your soft skills. And those are the skills that are very hard to teach because some of us come from an environment where we're kind of as little people, I have two granddaughters. As little people, we learn soft skills in terms of interpersonal communication skills and courtesy and listening, active listening, being able to work with people and being able to show up on time at work and being a professional with respect to how you appear. Not that we want to judge appearance, but obviously, just really taking good care of our and having work-life balance. So I know I shouldn't be speaking about all of that on an artificial intelligence presentation, but those soft skills are what really separate us from those robots. So very important for your career. And Dr. Moreland is shaking her head, and I can see that she's someone that probably encourages that and focuses on that with her students. So thank you for this time, and I think you do have some questions, Dr. Moreland.
I did, and thank you so much for that presentation. You covered a lot of things, and you and I have talked about this before, and it's almost like learning something new all over again. So I just appreciate how in depth you went with in regards to AI and how that's used within compliance, and specifically how you're able to send that back to HIM professionals in particular. So I appreciate that. But for those that are new to compliance, what foundational skills or certifications do you think that they may want to pursue if they want to get started?
Ah, so we do see HIM professionals transitioning into compliance roles. It's a great question. And certifications, the CHC certification through the Healthcare Compliance Association is a very solid certification. They offer both healthcare compliance CHC certification and a special one in privacy. And I think HIM people any experienced HIM professional will probably have a nice baseline of knowledge with respect to healthcare privacy. And so that might be something that is a real easy transition. But if you're more interested in the coding side of compliance, not that compliance professionals perform coding, but they understand the basics of it and they work closely with coding professionals and coding auditors as compliance professional. I had learned so much from healthcare compliance auditors and the coding auditors. And so if you're interested in that, the CHC certification is probably the route to take. But just kind of browsing the Healthcare Compliance Association HCA website or their industry side, which is I think the Society for Healthcare Compliance. If you're going to work on the industry side with medical device or pharmaceutical industries. Those are great websites to start reading and looking at to learn kind of some of the basics.
Okay. I love that. And also because I know that you have a plethora of years of experience, especially in that type leadership position, what are some common career paths within healthcare compliance, and how can someone transition into those roles, especially if they're coming from a different aspect of healthcare?
So specifically, Dr. Moreland, would you like to know if you're an HIM professional already, or if you're a student, or both going into?
Maybe both, and maybe even some for those that may listen to the presentation, that are outside of HIM, but are kinda,
Mhm,
like, looking at getting into it. What do you
mhm.
suggest?
Well, typically in a large healthcare organization, the best starting place is with a specialist position, a compliance
Mhm,
specialist position. So if you have some experience in HIM or some healthcare experience, even if it's on the clinical side, because you develop that terminology. So if you have some healthcare terminology, it helps you a lot. And you might be considered for an actual compliance specialist position where you work with the compliance manager, the compliance director, the compliance officer to put together a work plan. And that's how you learn what goes on in a compliance department. We have a work plan every year. You might also be helping with some simple monitoring. Um, uh, how many of our doctors are receiving over $50,000 in industry for speaking and consulting and that type of thing? Or coordinating with the compliance coding auditors who are part of the compliance team in another branch of the compliance. Usually in a large organization, there's quite a few compliance departments, and some of the compliance departments hire coding auditors. So you could get a job if you already had coding basics, you could get a job on
mhm,
that team, or you could be a specialist with the compliance officer who works with those auditors on investigations. So getting once you start looking at that Healthcare Compliance Association website, you'll start to see the different areas of compliance that you can work in. Compliance roles in a smaller organization, they typically want someone who's had compliance experience because they don't have a large department.
mhm.
However, a small organization might need somebody to help their compliance officer. They can only hire one other person, and they need someone to hire to help that compliance officer. Or they don't really have a very robust compliance program and they're looking for someone to develop it. So if you've been learning a lot on your own, or you've worked as a compliance specialist somewhere already, or you've worked as a compliance coding auditor in a compliance department, you might be able to get into a smaller organization that way. So the number one rule though is go somewhere where the mission is one that matches your core values, that the people are going to be supportive of you, and that you feel that the job they're giving you, you have either the knowledge and skills already, or you can learn them quickly, because you don't want to be frustrated and you don't want to be asked to make decisions without the proper knowledge and information. So learn as much as you can, as fast as you can, and work with good people, I guess, is the best advice I can.
That's beautiful. And I often tell students and professionals that sometimes we have experience with doing some of those things that compliance officers or whatever type of career that we're looking into. It's just about being able to translate those skills and experience that we already have so that it matches what that potential career looks like. So maybe if you're an HIM professional and you've already done some type of compliance related role, if you're able to translate that in a way where it's actually adaptable and the hiring manager can see that, then I think that it also increases your chances of being able to get into those next level positions. I think that's really important.
And I would say also that, going back to soft skills again, if you're
Mm,
not comfortable reaching out to people for informational interviews, find someone who
right.
can help you with that. Get a mentor, or talk to one of your extroverted friends
Yeah.
and find out, because you can go and ask a compliance manager or director, or sometimes a compliance officer who's willing to donate time outside of the workday to meet you for coffee or lunch, or somehow communicate with you to explain how compliance departments are run, and with what kind of skills and background they're looking for when they hire people. Even an HR department at a large organization may be willing to sit down and give you an informational interview to help you understand how you might be able to work with the informatics department because you have
Hmm.
experience with the EHR. I mean, there are just so many roles in healthcare right now. And one of the things that I read recently too was surprising to me. The Department of Labor's the United States Department of Labor released some statistics in 2022 and said between 2022 and 2032, HIM professionals are expected to have an increase of 8% in job opportunities. And I don't know
Wow.
if you already knew that, Dr. Moreland, but I didn't. And so I hope that hasn't changed. That was from 2022. But yeah, I just think those people who are willing to ask how and why and what are the ones that are going to get those opportunities.
Absolutely. And so you've kind of touched on this a little bit already, like when you talked about some of the organizations and networking groups and things like that to gain experience. But what are some other resources that you can think of for someone that's looking to build their expertise in compliance? Like, for instance, and I'll talk about it in the next slide or so. I have a skills assessment that I give to students, and they take it, and based off of that, it kind of tells them these are the areas that you may want to develop. So if there are areas that they need to develop, what do you suggest they do in order to get that expertise?
Well, if you have an ability, if you already are working somewhere and they give you education dollars that you can use, I would say, be willing to sign up for webinars and for courses that seem to be an interest to you that you think would be, helpful in your career. And find someone who's taken that course or find someone who's taken that webinar and ask them, was that helpful? Was it, if it's an on-demand webinar? Or one that's coming up. Ask people in the department you're looking to work in or people you already work with, what do you think of this particular webinar or this particular course? And if you don't have dollars that you can use, are you willing to invest in yourself and use your own dollars to take something? I did that a long, long time ago. I took a course in compliance when I was a practicing lawyer just to see what is this all about. They keep talking about these compliance officers. What in the world do they do? And I was willing to take it was like probably $100, and it was a long time ago. And it was a decision that I had to make. Was I willing to, 25 years ago, was I willing to spend $100 on myself? And I said, yes, I am. And then, years later, I'm the chief compliance officer at a large organization. So be willing to invest in yourself if you don't have an employer that will pay for courses. The other thing you can do at no cost is to be looking again on the healthcare compliance website and find out, are there any articles there that are free to read? Or are there any webinars out there that are free from healthcare law firms? Their law
Mm,
firm, Berry and Nelson Mullins and Posinelli, and I'm trying to think of some of the other really, really good ones. They oftentimes have free webinars on their website or free articles to read. I mean, you can learn so much about compliance on a healthcare law firm's website.
I love that. That is a great tool, and I never thought about that. So
you'll
see, I'm
be
learning
you'll
something
be
new.
zooming in soon, I'm sure.
Right, absolutely. And I wanted to know, we have Dr. Sabri with us. She's on the call today, and she is the owner and founder of The Qualified, and she was so wondrous in sponsoring this event for us. But I also wanted to open the floor for you, Dr. Sabri, if you had any questions that you wanted to ask as well.
I did. I was so anxious. I dropped them in the chat for you.
Oh,
I'm not
sorry,
even
I
looking at
didn't.
the chat. I'm
This,
sorry.
this is okay. This was fantastic. Thank you so much. I felt like there was so much that you touched on, Elizabeth. Specifically the minimum necessary rule, the BAA requirements, the comment that you made about AI being able to re-identify. That is so scary, right? Because we try and do our due diligence, right, and de-identify these records. So that makes it hard, and it makes me wonder too, or I'm very hesitant about the use of AI. I know we can do some great things, but I know there's a lot of people in our industry who are anxious to become data analysts, right? And they want to look at data and create, visualizations, tables, and charts. So they find themselves sticking all kinds of stuff in AI. And I'm very, I always try and encourage my students to be careful of that, right? Would you want your information into a system that's going to save it, or that's going to use it for, God knows what, So I think that those are some of my personal concerns. But Dr. Moreland, I honestly can't remember the other questions I had. I just typed them really quick and I put it enter. But that was like the first one that kind of, or the first comment rather, that kind of came to my mind.
And I guess I can just respond to your comment, Dr. Sabri. It is a concern. I think one of the best things you can do if you're interested in working in HIM, where you're handling data, or you're going to get into a data department, or you're going to work in compliance, is get to know the leaders who are the data experts, as they hopefully know how their organization is protecting that data, how the AI tools are going to protect their data. Population health is a huge, huge part of healthcare right now. A lot of jobs, a lot of revenue, a lot of operating expenses are dedicated to help organizations support population health and making sure that we take care of our population to lower healthcare costs and get any kind of metrics that help us save dollars that normally we would lose, but the government's willing to reward us for good quality metrics. So population health is big. And it might be through your accountable care organization, it might be through your population health organization, but whatever a big organization has for accountable care and population health, that's where a lot of the best data people are. There's a brilliant data analysts in those departments, and Dr. Moreland's shaking her head. She probably knows all about this. She probably knows more about it than I do, but I've worked with some amazing data people in population health and accountable care accountable care departments within organizations. And those actuaries and data analysts, they should be closely tied to what AI tools are being used, Dr. Sabri, and hopefully that is going to save us.
Thank you.
You're welcome.
Perfect. Okay, but before I let you go, if you're new to compliance and you want to learn about which area within information management, well, information governance and compliance will work best for you and your skill set, I do encourage you to take my career assessment, which is a quick 10-question survey that'll help pinpoint the area that might mesh well with your interests. It also comes with a skills gap analysis so you can see the areas where you need to improve. And it's loaded with information about potential careers and education that you might want to invest in. So I do suggest if you're new and you just want to kind of figure out where to go from here, that you do take that as well. And I really don't have anything else outside of that. But if you wanted to reach out to me and contact me, if you want to work together to hone in on your compliance skills, here's my contact information. I put it on a nice little QR code because I found a nice way to use technology to put everything in one thing. So I'm really proud of it. So you'll probably see that QR code everywhere just because I'm proud that I have it. And so that's how you reach out to me at any time. And Elizabeth, I didn't see anything about your contact information. How can they reach out to you if they want to learn more from you?
So sorry about that. So my email address is Elizabeth Skinner, no dot, Elizabeth Skinner 8589 at gmail.com. And I check my Gmail every day, but if for some reason it doesn't come through, call Dr. Moreland. She'll find a way to get a hold of me.
Absolutely. Absolutely. Well, I want to thank you again for taking the time to share your knowledge with us. I learned a lot. I'm sure I'm going to review this recording several different times. I can't wait to incorporate it into my classroom. And just thank you for just volunteering and giving us all this information. This was great.
Oh, you're welcome. Have a great day, everyone.
All
Thank you.
right. Take care.
Nice to meet you, doctors.
You too. Thank you.
Bye.
Bye-bye.